When given an IM injection into the gluteal muscles, the ventrogluteal site is the preferred site. The reason for this is it's safer. There's less risk of hitting arteries or nerves in this area. Also, typically, patients' tissue is thinner on their side in the ventrogluteal site versus the dorsogluteal, so you're more likely to get the injection in the correct position into the muscle rather than the subcu tissue. Also, in statistics, this has been shown to be less painful.
Okay. When administering an injection into the ventrogluteal site, finding the correct landmarks is the most important part. So to do this, one of the best ways is to have the patient stand, kick their foot out in front of them, and twist their foot back and forth. And you want to feel into their hip until you can feel the greater trochanter. And what you want to feel is you want to be able to feel the trochanter actually turning inside of there so you know that you have the right landmark. So depending on the patient's anatomy, you have to get in there pretty good to be able to feel this. Once that's identified, you keep your hand on that spot, and to find the exact spot, you put the palm of your hand over where you found the greater trochanter. You always want your thumb facing towards the patient's pelvis. You want your middle finger up almost straight, and you're going to kick your pointer finger out, and your injection site will be right in here. The site should feel pretty soft where it's not right up into the iliac crest, where up here it's more hard, you can feel bone. It's going to be right in here in this injection site.
Some additional tips when given a ventrogluteal injection is, one, make sure that you have appropriate needle length so that you are getting into the muscle and not into the subcu tissue. To help decrease the amount of pain when given this injection, you can lightly tap on the site prior to the injection. This helps stimulate the nerves so that it's less painful. When given the injection, hold the needle in after you've infused the medication for about 10 seconds before you pull the needle out. This will decrease the amount of fluid leakage from the muscle, decreasing the amount of irritation to that area. It's no longer recommended to massage the site after an injection. That can push some of the fluid out into the subcu tissue, making it more painful. So just holding pressure over the site to stop bleeding is adequate enough. Don't massage the muscle. One other tip with this is, if you're given in the dorsogluteal site, you don't need to assess for blood return when you've done your needle placement. You only have to do that for the dorsogluteal site. So ventrogluteal, you do not need to assess for blood return. You have to when you're doing the dorsogluteal site because of the risk for the gluteal artery. When you're doing ventrogluteal injections, the most challenging part is finding landmarks and feeling confident in your injection. So make sure that you get lots of practice. If friends or family will let you do assessment on them so that you can really get good at finding that greater trochanter and really using the landmarks to identify your site is super helpful. The more comfortable you get, the more confident you'll be. Your patients can feel that so that you can continue to give good injections. And as always, reach out to me if you want further help practicing this. Thank you.